BPH is also called as benign prostatic hyperplasia. It is non-malignant growth of prostatic cells in numbers as well as size, and they are just an enlargement of physiological prostate as the age grows on. That is called as BPH. Basically, prostate is a male sexual organ. It is of walnut size, located at the bladder base, and it surrounds around the urethra. So, it is required for the production of semen. It contributes to 20% of the semen content. It helps in nourishing of the sperms and protects the sperm. Hence, it is important for the reproductive functions of the male. Any men generally after 40 years they can get BPH, but it is more commonly in elderly male populations, elderly men. So, as the age increases, BPH symptoms as well as the BPH size of the prostate increases. However, it can get even at the 40 years of age, though less frequency. Risk factors for this usually many includes the sedentary lifestyle. These are more common in people compared to the exercise and normal daily activity people. So, other things is obesity and some other risk factors will be there, and very common hereditary, as it is very common that 4 to 5 times it increases in the siblings who had their father or forefathers who had a BPH. Since the prostate is located at the bladder base and around the urethra, as the prostate grows in the BPH or benign prostatic hyperplasia, it enlarges, it constricts the urethra and causes all the symptoms related to it. So, what are the basic symptoms is either initiation of urination will be difficult, and the passage or the stream will be low, and the sensation of bladder, that is anyone senses the number of more frequency of micturition they need to pass, and sometimes it causes obstruction to the bladder outflow, sometimes it shut down the urinary flow, and especially in the midnight they keeps on waking up to pass multiple times the urination. These are the symptoms related to BPH. BPH has a stages mild, moderate and severe prostate enlargement, but the prostate size as such does not clearly we can correlate with the symptoms of the BPH. Sometimes a small BPH can produce a severe symptoms. However, this BPH based on the severity we have to treat based on the enlargement, and hence it requires the treatment based on the severity. BPH by name itself, it is benign prostatic hyperplasia. BPH is not the cancer, but cancer cause enlarges of the prostate. Both the things can be differentiated by only few things like hormonal assessment of like PSA, prostate specific antigen, as well as sometimes it may, if it is high, we can go for the biopsy and histopathological examination, and sometimes MRI with the spectroscopy also gives rise. So, BPH is entity is different, and it does generally in a notion it does not cause give rise to the cancer, but cancer can mimic the BPH by again enlargement of the prostate. BPH is very commonly diagnosed first of all based on the history and followed by few minimal investigations. Simple clinical examination can be done through per rectum digital per rectum examination, as well as the most common thing is the ultrasound. Ultrasound abdomen and pelvis will give rise to the BPH diagnosis, and also it gives the functional assessment, that is residual urine. That means once one who passes the urine, whatever the amount which is stored behind even complete voiding of urine, that gives the functional residual status of and the severity of the BPH. And many modes are there which also gives BPH, like MRI prostate also can give rise to the diagnosis of the BPH. Symptomatic benign prostatic hyperplasia has to be treated to avoid the complications. Most common thing is medical management, wherein we give few medicines to relax the muscles around the urethra and also reduce to some extent shrink the prostate. However, if they are ineffective, we have to go for the other modes of treatment, either include the traditional surgery includes like TURP, transurethral resection of prostate, wherein through the urethra the instruments have been put inside and to widen the passage of the urethra around the prostate. Within the prostate. The other method, most modern thing, is the prostatic artery embolization, wherein the blood vessels supplying the prostate are selectively blocked to cause the shrinkage of prostate. Prostatic artery embolization, it requires pre-surgically to prove it is only benign, that is non-cancerous enlargement of prostate, it is BPH, and it requires certain minimal blood investigations including the renal function test, and especially most important thing is prostate specific antigen value. It has to be generally, it should be below 4 and it has to be well documented to prove it is a benign, and followed by a minimal invasive imagings like ultrasound to document the size of the prostate, and hence few blood tests before the procedure including bleeding time and clotting time. These are the minimal requirements in the procedure preparation of PAE. Basically, prostatic artery embolization is the selective embolization of prostatic arteries to shrink the benign prostatic hyperplasia, wherein we can enter into the radial artery in the hand and then go through the aorta and then selectively into the prostatic artery below, and then embolize selectively only prostatic arteries under local anesthesia, wherein patient can be in the conscious state. It may take half an hour to 2 hour procedure, and after that immediately patient can walk and go out of the cath lab without any pain. PA is involving the blockage of blood vessels, and then it is under local anesthesia, painless, and no blood loss, and daycare procedure, and hence minimally invasive. Whereas the traditional surgery, it includes a transurethral entry and a lot of blood loss, electrolyte imbalance, painful, and it has to be done under general anesthesia, and it requires admission for 1 or 2 days. It is very simple in the post procedures of PAE. They can be discharged in the same day, and they can be take the self medications in the home in the from the day of discharge, which includes minimal antibiotics and few pain relieving medications that has to be taken for few days, and then nothing else. They can routinely take their regular ailment medicines.